Senator Atulajan.
Thank you. Minister, in my work as a parliamentarian, I've had the opportunity to witness Canada's important contributions to maternal, newborn, and child health in developing countries and in regions facing humanitarian crisis. These efforts are commendable and often life-saving. However, here at home, many Canadians continue to face gaps in access to maternal and infant health services, particularly in remote communities. These are evidenced by marked inequities in maternal and infant mortality. It is concerning that similar urgency and sustained focus are not consistently reflected domestically. Minister, can you explain why persistent challenges in infant and maternal health within Canada continue to lag behind?
Good question.
Madame la Ministre.
Minister.
Well, I know there are some challenges, particularly, I would say, in remote and rural communities where, the lack of health professionals could prevent big gaps. Again, it's, on provinces and territories who are delivering the services that it should be addressed, but again, I won't put all the blame on them. We have to work together. And this is why, for example, I am in close contact with the rural physician. I'm hoping to see the technology helping us address some gaps, because when I tour, I already see what it can do on the ground. I think where it can help also, we see more and more nurse practitioners going in some region that could help. I just was in Quebec in a remote area, and we were talking exactly about newborn and pediatric, services, and it was done by a nurse practitioner, and it seems that it changed completely the face of how mothers and children are doing in that area.
Merci, Madame la Ministre. Senator.
Thank you, Minister.
So, Minister, while infant mortality rates have improved over time, Canada still ranks behind other OECD countries. At the same time, our maternal mortality rate has more than doubled in the past 20 years. Given these realities, what specific measures will your government commit to in order to ensure that Canadian mothers and infants have timely access to the care they need?
Madame la Ministre.
Minister.
Thank you, Senator, for the question. Again, it's something that I will raise with my counterparts. And as you know, the way I'm doing, the provinces and territories have to prioritize choose their own priorities, and my role is to support and push them on that. So I can bring the conversation about the mortality rate and see how we can improve, because I'm ready to support, but I'm not the one delivering the services.